Okay, sir.
A very good morning to all the participants over here. I welcome you all on this third session of pharmacovigilance lecture. Today we are having two eminent speakers with us. Let me introduce them first. Your first lecture is going to be conducted by Mrs. Rushali Neve Madam. Earlier also she has taken your lecture. So basically she is having wide experience of giving the training to pharmacovigilance students. So and second our speaker is Mrs. Tejal Khade Madam. She is also having very good hands on pharmacovigilance training. She is having wide experience of 4 years at Cognizant. So without wasting time, I would welcome Vishali ma'am and request Vishali ma'am to take over the session for your further lecture. Vishali madam, please.
Okay. Good morning, all of you. Yes, 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 yes. Good morning, all of you. So today we will start with the remaining part of adverse drug reaction. Okay. Within a second, I am showing the slides. Okay. So let us start with the adverse drug reaction. In last lecture, we have discussed about the definition of adverse drug reaction, then what is the adverse drug event, then we have discussed the difference between adverse drug reaction and adverse drug event. After that, we have discussed the epidemiological factors of the adverse drug reaction, then the classification of ADR. Okay, then we have also discussed about the what is the type A, type B, type C, type D. Okay, likewise we have discussed about the classification of the adverse drug reaction. So today we will start with the detection and monitoring of the adverse drug reaction. So let us start with detection and monitoring of adverse drug reaction. So detection and monitoring mainly involve four steps of the pharmacovigilance. So first step is pre-marketing studies, second step is post-marketing surveillance, third one is under reporting, and fourth step is the communicating ADRs. Okay, so let us discuss about this stepwise. So pre-marketing studies means whenever the clinical trial is going on, the first it will start from the first phase to last phase. Okay, so clinical trial mainly having the five phases, that is starting from the phase 0, phase 1, phase 2, phase 3, and phase 4. Okay, so first phase, that is 0 phase, is also called as the microdosing phase. So starting from the pre-marketing studies, the efficacy and potency of drug will get to evaluate, that is called the pre-marketing studies. Then post marketing surveillance mean whenever after the completion of third phase of the clinical trial, the drug will ready to launch in the market. Okay, so after launching the drug in market, they whatever the ADR will report from the all factors of the society, that is called the post marketing surveillance, that is phase 4. The post marketing surveillance is also called as the pharmacovigilance. Okay, that is nothing but the last phase of clinical trial. Then third step is called the under reporting. Once the report will reach to the pharmacovigilance center, they will start to conduct the monitoring on that particular area of the drug. that is called the under reporting section. Then fourth phase is the communicating area. Okay, once the process will going on in the pharmacovigilance center, they will try to monitor the whatever adverse drug effect is reported to the PV center. Okay, so that whole process is called the communicating area. Okay, so then whatever the monitoring step will be there, so first step is the identify the adverse drug reaction. Okay, so whatever the adverse drug reaction observed in case of any drug, that should be observed by patient, doctor, nurses, or any type of the physician, then it should be reported to the pharmacovigilance center. That is called the phase 4, that is post marketing surveillance phase of the clinical trial. Then second step is assessing causality between drug and suspected drug reaction by using various algorithms. Once the ADR is reported to the PV center, they will try to assess the causality relationship between drug and suspected reaction by using various type of algorithm or methods. Then once it will detect the algorithm, they will start to document the ADR part. Okay, so next step is the documentation of ADR in patients medical records. Then next step is reporting the serious type of adverse reactions to pharmacovigilance center or with any type of the medical authorities. So in this way, they will try to report the medical whatever the adverse drug reaction obtained in case of any type of drug, it is reported to the particular PV center. So let us start with what is the pharmacovigilance. Pharmacovigilance is the science and activities relating to the detection, assessment, understanding, prevention of the adverse effect or any drug related problem. So what is the pharmacovigilance? Pharmacovigilance is nothing but the it is the science that related to the detection, assessment, understanding and prevention of the particular type of adverse drug reaction or any problem that related to the drug. Okay, so the information is generated that is useful in educating the doctors and in official regulating of the drug use. So it has important role in rational use of medicine as it provide the basis for assessing safety of the medicine. So pharmacovigilance is the branch of science is mainly related to the detection, monitoring, assessment, understanding and prevention of the adverse drug reaction or any type of problems that related to the particular drug. So as I told, the pharmacovigilance is also called as a post-marketing surveillance, and that post-marketing surveillance is nothing but the phase 4 of the clinical trial. Okay, so various activities involved in the pharmacovigilance are first is the post-marketing surveillance and other methods of the ADR monitoring such as voluntary reporting by doctor, then prescription event monitoring. Then second is the dissemination of the area data through drug alerts, medical letters, advisors sent to doctors by pharmaceutical and regulatory agency. Okay, so once the whatever the ADR will be observed by any type of the society members, it should be sent to the doctors by various pharmaceutical and regulatory agencies. Then change in the labeling of medicine indicating restrictions in use or statutory warning, precautions, or even withdrawal of the drug. So, whatever be instructions are given, that should be clearly given on the labeling. Then next is the Uppsala Monitoring Center. So it is the biggest center where we can report the adverse drug reaction. So Uppsala Monitoring Center that's situated in Sweden is the international collaborating center. And what is the main function of that Uppsala Monitoring Center? We have to report or that will collect all type of report regarding adverse drug reactions from all society members. But in India, the national center is located at Ghaziabad. So remember that in India, where the national center is situated, that is Ghaziabad. And what is the function of that Ghaziabad center? They will collect the all reports regarding adverse drug reaction. The next is peripheral centers at the medical college level and tertiary and above hospitals. Okay, so as like the national center, the various small centers for the reporting of ADRs are also available in the various hospitals. So reports generated by doctors, paramedical staff to peripheral centers, national centers. So first, the doctor or any type of paramedical staff will report to the national center first regarding the ADR of the drug. Then that national center will report that to Uppsala Monitoring Center, and where the Uppsala Monitoring Center is situated in Sweden. So compiled report will be sent to the national center and national center will report that drug and adverse drug
Your
reaction.
mic is
Okay, they
muted.
will. Hello.
Vishali madam?
Yes, sir.
Yeah, yeah, yeah. Now you are audible. Continue, continue.
Okay, okay. So this is the whole process how exactly the reporting and the conduction of monitoring ADR will be going on. So first, the any type of paramedical staff or doctors will report that ADR to the particular national center, that is Ghaziabad center. That Ghaziabad center will proceed that all ADR reports to the or hand over that all ADR reports to Uppsala monitoring center. Once the Uppsala Monitoring Center received whole data regarding the reporting, they will compile that data, analyze that data, and they will detect causal relationship between the drug and adverse drug reaction. And they will confirm that relationship. After that, the guidelines issued regarding the safe use of the medicines or restricted use or withdrawal from the particular patient. Okay, so this is the whole process how exactly the reporting starting from the reporting of ADR up to the monitoring of the ADR will be going through first national center that's situated in Ghaziabad and Uppsala monitoring center that's situated in Sweden. Hello.
Yes, madam. Yes, madam.
uh, Sir, proceed. Can we go through next slide?
Yeah, go on next slide, madam. Please go on next slide.
Okay, it is visible now.
Yeah, it is good.
Okay.
Yeah, it is visible.
Now there are okay. Now there are two epidemiological methods which are most commonly used while monitoring the ADR. So which are these methods? First is the cohort studies and second is the control studies. So cohort studies means the patient exposed to the particular drug and follow up actively and systematically, and ADR frequency are compared to unexposed control population. So what is the cohort studies? So first, that patient will expose to the particular drug therapy, and whatever the ADR will be observed in such patient, that will be compared with other patient who is not who is not exposed to that drug. Okay, so that comparison will be going in the cohort studies. Then second is the control studies. So what is control studies? The individual affected by adverse event being studied are identified. See the difference between cohort studies and control studies. In cohort studies, what we are going to do the procedure? First, we will choose the patient. In that patient, we are going to give the particular drug, and whatever the adverse drug will be observed in such patient, we are going to compare that adverse effect along with the other patient who is not taking that drug. Okay, that is cohort study. And what we are doing in control studies? In control studies, we are selecting such patient who is already suffering from the particular ADR of the drug. Okay, so this is the main difference between cohort studies and control studies. So in control studies, the individuals affected by adverse event being studied are identified. Okay, then each case is matched with several disease free control patient randomly recruited from the study base. So in the control studies, we are selecting such individuals or such patients who are already suffering from the particular type of adverse drug reaction. So both cases and controls are investigated their exposure to possible causative agent prior to occurrence of the event, and the R ratio calculated on the basis of exposure data. Okay, so we are again comparing the both patient in control studies also, and after that R ratio will be calculated on the basis of exposure data. So this is about the cohort studies and control studies, and that two methods are used in the pharmacovigilance adverse drug reaction. In our India, the yellow card system is available. So, what is the yellow card system? The healthcare professions are argued to report the suspected areas directly to the medicines and healthcare product regulatory agencies through yellow card scheme using electronic form. So all type of the doctors, medicine manufacturers, pharmacists, okay, and how they will report? They will report to the yellow card scheme by using the electronic form. So this is the process how we have to report the adverse drug reaction to MHRA. And what is MHRA? Medicine and Healthcare Product Regulatory Agencies. Okay. So yellow card scheme relies upon voluntary reporting of suspected adverse drug reaction. So what is yellow card system? That yellow card scheme is mainly depend on the voluntary reporting of suspected adverse drug reaction. The patient and their carers can also report the suspected area to MHRA. So not only the pharmacists and doctors can report, but also patients will report the ADR to MHRA. The report can be submitted directly to MHRA through yellow card scheme using the electronic form. So remember that in our India, we are using the yellow card scheme for reporting the adverse drug reaction to MHRA. So in other countries, same system will be followed, but color is different. Okay. So in our India, by using the yellow card, we are going to report the adverse drug reaction. Now, who can report the adverse drug reaction? So, as I told, the professional working healthcare, that is doctor, physicians, nurses, okay, they can report the ADR to PV unit. Okay, for example, medical specialist, pharmacist, dentist, midwives, along with the HCP's patient, patient relatives, witness, or any common person after the medical confirmation can report adverse drug reaction to the pharmacovigilance unit. Okay, so these are the some society member who can report adverse drug reaction to the pharmacovigilance unit. So this is the flow chart how exactly the process of the reporting is going on. Okay, so first, who can report? The pharmacist, physician, medical specialist, clinical pharmacist. Okay, so they all can report the adverse drug reaction to regulatory authorities. Once the regulatory authorities receive that report, they will report to the pharmacovigilance unit. Once the PV center get all report from the society member, they will start the whole processing of the monitoring of adverse drug reaction. Okay, so first ADR will report it to the PV unit, then the data collection and analysis of data will be going on. Okay, then risk management and product recall will be there, and prevention of ADR mortality and morbidity rate will be decided on the basis of prevention of ADR. So this is the whole process of monitoring of ADR will going in the pharmacovigilance unit. So this is the flow chart for the who can report the ADR to PV center, and this is the flow chart that will indicate which process and how exactly the process of ADR reporting and monitoring will be going on in pharmacovigilance unit. Now how to report the ADR? Okay, so particular form is provided, okay, by various type of the PV units that's situated in India. So duly filled ADR reporting form need to send to the nearest AMC or direct to the national center for the pharmacovigilance. Okay, now also we can dial toll free number, that is 1800 180 3024 to report the ADR, or by mailing the ADR, that is we have to fill the ADR report form directly to the pvpi at ipciindia.net or pvpi ipciindia at gmail.com. Okay, so these are the some site that provided by our government also to report the ADR. Okay, so by this method we can directly report the ADR to PV center. Now, where to report? Various peripheral, region, and zonal centers have been proposed and established in India. Okay, so various type of peripheral, regional, and zonal centers are established in our India where we can report the adverse drug reaction. So first is the peripheral PV center. So it is the primary area information gathering center. It includes small medical centers, private hospitals, dispensaries, nursing home, and pharmacies. Okay, so in peripheral PV center, so who can report in the peripheral PV center, that is so medical center, private hospitals, dispensaries, nursing homes, and pharmacies. Okay, so they can report ADR to the peripheral PV center. So ADRs are recognized and synchronized by RPC and ZPC, that is the zonal and regional center for the PV. Okay, so every state, union territory, and few leading medical college in India have this peripheral center. Okay, so these peripheral centers can situated in the some medical colleges of the India. Then second is the regional PV center. So it's regarded as secondary PV center. So peripheral PV center is called the primary center for the reporting of ADR, and second is the regional PV center that regarded as the secondary PV center. Okay, so it is located in medical college having relatively larger facilities. So most of the regional centers for the PV is situated in the medical colleges. They are identified and coordinated by zonal center, and there are 5 such regional centers are available in our India. Okay, so regional centers are called also secondary PV center, and where they are situated, they are situated in the various medical colleges of the India. Okay, and who can coordinate this? The zonal center can coordinate the regional centers. Then third type of PV center is called the zonal PV centers. It's regarded as tertiary PV center. Now remember that peripheral is the primary center, regional is the secondary center, and zonal is the tertiary center for reporting of ADR in PV. Then generally that zonal centers are located in metro cities medical college having attachment of sufficient facilities. Okay. Now where the zonal centers are situated? They are situated in the metro cities medical college, and that medical college must have the sufficient facilities regarding the PV monitoring of the area. So it is identifies CDSCO. CDSCO is the medical authority bodies and act as a first ADR data collection centers. Zonal center for North and East zone is the AIMS. Okay. So for North and East, the zonal center is the AIMS. AIIMS. Okay. So these are the three types of the PV centers where we can report the adverse drug reaction, that is peripheral, regional and zonal PV center. The next is the prevention of adverse drug reaction. Now, how we can prevent the adverse drug reaction? First, we avoid the inappropriate use of the drugs. Second, the appropriate drug administration, that is rational therapeutics like dose, dosage form, duration, route, frequency, and techniques. Then ask for the previous history of the drug reaction and allergies. So once, whenever the pharmacist counsel with the patient, they should ask the previous history to the patient, whether that patient having the particular allergic reaction from the previous drug treatment. Okay, so in such way they can resolve the problem and alter the drug therapy in such patient. Then always suspect ADR when new symptoms arise after the initiation of treatment. Once the patient has received the treatment from the doctor, if the patient found that a particular allergy will be occur in some cases, then immediately that patient have to suspect the that particular drug treatment. Okay, and ask for the laboratory. In laboratory we can ask what is the reason why exactly that allergic reaction occurs in the particular case of the drug. Okay, so this is the preventive measures, how exactly we can prevent the adverse drug reaction of particular drug. Okay, now adverse drug reactions again categorized as side effects, secondary effects, toxic effects, intolerance, idiosyncrasy, drug allergy, photosensitivity, drug dependence, drug withdrawal reactions, teratogenicity, mutagenicity, and carcinogenicity. And last is the drug induced disease, that is heterogeneity disorders or the heterogenicity. So these are the some types of the or these are the some terminologies that comes under the adverse drug reaction. In short, we will discuss the definitions of that terminologies. What is the side effects? Side effect is nothing but the unwanted effect of the drug. Okay, so we can say that side effect is the unwanted or unavoidable pharmacodynamic effect of the drug. Okay, so it will occur at any type of therapeutic doses and we can predict the side effects. Okay, for example, benzodiazepine. In case of benzodiazepine, what is the side effect? Major side effect, that is motor incoordination. And in case of H1 antihistaminic drugs, what is the side effect? That is sedation. So this is the definition of side effects. Then second is the secondary effect. What is secondary effect? Indirect consequences of primary action of the drug. Okay, so secondary effect is the indirect consequences of primary action of the drug. Once the patient receive the drug treatment, immediately whatever the first effect side effect observed in such patient, that is called the secondary effect. For example, corticosteroid weakness. Corticosteroid weakness host defense mechanism so that latent tuberculosis gets activated. Okay, so we can say that corticosteroid induce the tuberculosis. Then third terminology is called the toxic effects, also called the poisonous effect. Okay, so toxic effect is nothing but the overdose, or we can say that if patient taking the particular medicine for longer period of time, whatever the effect will be, side effect will be observed, that is called the toxic effect. Or if patient taking the overdose of that drug, it will causes the toxic effect. Okay, so toxic effect is nothing but the overdose or the prolonged use of the drug. So the effects are predictable and dose related. Oh, why it is called predictable? Because if you are minimizing the dose or taking the low dose of the drug, so we can cover or we can prevent the toxic effect of that drug, and that's why it is the predictable type of adverse drug reaction. So, the toxic effect mostly observed in CNS, CVS, kidney, liver, lungs, skin, and bone marrow are most or common organs which mainly related to the drug toxicity. The next terminology is intolerance. What is the intolerance? It is appearance of characteristic toxic effect of the drug in individual at therapeutic doses. Now, what is the intolerance? Intolerance means the whatever the characteristics toxic effect will be observed at the therapeutic dose in individual, that is called the intolerance. Okay, so it indicate a lower threshold of the individual to action of the drug. Okay, so the intolerance should be indicated in the low threshold of the individual to action of the drug. An example of intolerance are only few doses of carbazepamine may causes ataxia in some patients. This intolerance is the unpredictable type. Okay, we can not predict the at what doses that intolerance will be occurred, and that's why it is called the unpredictable type. The next terminology is called the idiosyncrasy. So, what is the idiosyncrasy? It is genetically determined abnormal reactivity to a chemical. Idiosyncrasy means the genetically determined abnormal reactivity to particular chemical. So, when you are using the particular chemicals, okay, so whatever the abnormal reaction will occur in some case, such cases of the chemicals, that is nothing but the idiosyncratic effect of that chemicals. So drug interact with some unique features of the individual not found in majority of the subject and produce the uncharacteristic type of reaction, and that uncharacteristic type of reaction is nothing but the idiosyncratic reaction. So examples are chloramphenicol produce non-dose related serious aplastic anemia in rare individuals. Okay, again genetically it is related to the patient. Okay, second example is barbiturate causes excitement and the mental confusion in some individual. Okay, so and why it is occurred? Because of the genetical abnormality of particular chemical. Again, it is the unpredictable type of reaction. We cannot predict because it is genetically produced particular causes, and that's why we cannot predict such type of reactions. That's why it is called the unpredictable type of idiot. The next terminology is the drug allergy. Drug allergy, also called the hypersensitivity reaction. Okay, so it is the immunologically mediated reaction that produce stereotype symptoms which are unrelated to the pharmacodynamic profile of the drug. Okay, so what is drug allergy? Drug allergy is nothing but the hypersensitivity reaction, and it is mainly related to the immunological mediated reaction. Okay, and that immunological mediated reactions related to pharmacodynamic properties of the drug. Okay, so it is generally occur with much smaller doses even. Okay, so not only the higher doses, if you are using the very lowest drug or dose of the drug allergic reaction can occur in such cases also. So again it is unpredictable, and why it is unpredictable? Because the dose is not decided, means at what dose the drug allergic reaction will be occurred, it is not decided, and that's why the drug allergic reactions also called the unpredictable type of reaction. Then these are the some types of allergic reaction. Okay, that is drug allergic reaction. First is the humoral allergic reaction, and second one is the cell mediated reaction. The humoral again divided into three types. Type 1 is called the anaphylactic reaction. Type 2 is called the cytolytic reaction, and type 3 is called the retarded or Arthur's reaction. And second type is the cell mediated, that is type 4. This is called delayed hypersensitivity reaction. So these are the type of allergic reaction. The next terminology is the photosensitivity. So it is cutaneous reaction resulting from the drug induced sensitization of the skin to UV radiation. Suppose any patient taking some particular drug, and immediately the UV rays will fall on the skin of such patient. Okay, so the drug will get reacted with that UV radiation, and that will causes the photosensitivity reaction. Okay, so photosensitivity reaction again divided into two types. First is the phototoxic reaction. So drug or its metabolite get accumulated in the skin. Okay, so what is the phototoxic? In phototoxic reaction, the metabolites of the particular drug will get accumulated in the skin, and UV rays fall on the skin. That metabolite of the drug will react with that UV radiation. That is called the phototoxic reaction. Okay, so they absorb the light, undergo the photochemical reaction. So what happen if UV rays fall on that metabolite? First, that metabolite of the drug will absorb that UV radiation, and they will undergo the photochemical reaction by photobiological reaction. And what is the result? The tissue damage will be there. Okay, so suddenly the skin will be get damage. That is called the tissue damage, and the effect is the sunburn effect. Okay, so slowly the color of the skin will get changes. Okay, that will change like the blackish color. Okay, and that blackish color will indicate the damage of tissue. Okay, so the some cases reported under the tissue damage like erythema, edema, blistering, hyperpigmentation, and discoloration. Okay, so these are the some types comes under the tissue damage. So this is about the phototoxic photosensitivity reaction. Okay, and which radiation is responsible for phototoxic? That is shorter wavelength that comes from the 290 to 320 nm UVB. Okay, again UV radiations are mainly divided as UVA rays and UVB, but in case of phototoxic, UVB radiations are mostly responsible for causes the phototoxic type of photosensitivity reaction. Then second type is photoallergic reaction. So drug or its metabolites induce cell-mediated immune response which on exposure to light of longer wavelength, that is from 320 to 400 nanometer. Okay, so in photoallergic what happened? The cell mediated reaction that is induced by the metabolite of the drug. Okay, so that cell mediated immune response will react with the exposure of the UV rays at what length? That is 320 to 400 nanometer. And in photoallergic reaction, UVA rays of sunlight are responsible for causing the photoallergic reaction. So they will produce popular or erythematous contact dermatitis like picture. Okay, so dermatitis will occur in the photoallergic reaction. And which drugs are involved in photoallergy? That is sulfonamide, sulfonylureas, griseofulvin, chloroquine, and chlorpromazine. So these are the some drugs and its metabolites which will react with the wavelength that is 320 to 400 and causes the photoallergic reaction like erythematous or dermatitis like pictures. Okay, then next is the drug dependence. So what is drug dependence? Some persons are habituated for taking the particular drug. Okay, so whatever the pharmacological effect is expected from that drug, okay, so that patient will use to of that pharmacological effect of the drug. That is called the drug dependency. Okay, so use of the drugs for personal satisfaction. Okay, so patient will get satisfied by using the continue use of that particular drug, and that is called the drug dependency. The higher priority than other basic needs, often in the face of known risk to the health. Okay, so in case of particular patient, the main priority of that patient is nothing but the to taking that drug continuously for their satisfaction. Okay, so this is called the drug dependency, but it is very risky for the health of that patient. Okay, so physical dependency means it is altered physiological state produced by repeated administration of the drug. Okay, if that patient taking continuously the drug, what that drug will do? That drug will alter the physiological state of that particular patient. Okay, and necessitates the continued presence of the drug to maintain the physiological equilibrium. So in such cases, to maintain the physiological equilibrium, the patient have to take continuously that tablet or particular medicine. Okay, if we discontinue the drug, some characteristic withdrawal will be occurred, and that syndrome is called the withdrawal syndrome. Okay, For example, if the patient continuously taking the particular drug for maintaining the physiological equilibrium, and suddenly they will stop to take the drug, okay, so it will resulted in some syndrome that is called the withdrawal syndrome. Okay, so drugs producing physical dependence are opioids, barbiturates, other depressant including alcohol and benzodiazepines. So these are the some example of drugs which patient will continuously taking. Then drug abuse. So drug abuse is nothing but the use of drug by self medication in manner and amount that deviate from the approved medical and social pattern in given culture at given time. Okay, so what is drug abuse? Abuse means they without a prescription of the doctors, the patient will itself taking the medication, but in what manner? Whatever the manner provided by particular doctors or practitioners, healthcare practitioners, that social pattern, in that social pattern the patient will taking the medicine itself, that is called the drug abuse. Then second terminology is the drug addiction. Drug addiction means it is a pattern of compulsive drug use characterized by overwhelming involvement with use of a drug, and that procuring the drug and using it take precedence over other activities. So what is the other drug addiction means? What addiction means? It is the one of the habituation of the patient, compulsory they have to take the drug, that is called the drug addiction. Then drug habituation. That drug habituation is mainly related to the psychological dependency of the patient. Okay, so it denotes less intensive involvement with the drug so that its withdrawal produce only mild discomfort. Okay, but in a drug habituation, the patient will not continuously taking the medicine, means totally the patient is not depend on the drug, and that's why after withdrawal of the such drugs, whatever the effect will be observed in such patient, it is only mild type of the reaction. Okay, so consumption of tea, coffee, tobacco, social drinking are regarding habituating physical dependency is absent. Okay, so in drug habituation, for example, the patient is habituated to take the tea continuously, coffee, tobacco. So these are the when we are withdrawing such for example, we are withdrawing to take the tea, to take the coffee, it will not causes any serious effect. Okay, some mild effect will be occur in in such cases. Okay, that is called the drug habituation. Then drug withdrawal reaction. Drug withdrawal means, as I told, the patient is continuously taking the medicine and suddenly they stop to take the medicine. So whatever the effect will be observed or reaction will be observed, that is called the drug withdrawal reaction. So sudden interruption of the therapy with certain other drugs result in the adverse consequences, mostly in form of the worsening of the clinical condition for which drug was being used. So as I told, drug withdrawal reaction means suddenly to stop the administration of particular drug is nothing but the drug withdrawal reaction. For example, acute adrenal insufficiency may be precipitated by abrupt cessation of the corticosteroid therapy. Okay, so if some patient taking the corticosteroid and suddenly they will stop to take the corticosteroid, so which type of effect will be observed? That is acute adrenal insufficiency type of reaction will be observed in such patient. Then terminologies is teratogenicity. Teratogenicity, teratose. Teratose means the monster. Okay. So what is the teratogenicity? So drug to cause the fetal abnormalities when administered to the pregnant mother. Okay. So if pregnant mother taking some medicines, it will causes the fetal abnormality. Fetal abnormalities like absence of particular organs, or some organs are not fully developed. Okay, so such effect is called the teratogenic effect. Okay, so this teratogenic effect occurs at three stages of the pregnancy. So first step is the fertilization and implementation. that is conception to 70 days failure of pregnancy, which often goes the unnoticed. Then second is the organogenesis. So 18 to 55 days is the main period for the gestation. So most vulnerable period in which most of the organs are going to develop in fetus, that is 18 to 55 days. Okay. Then third is the growth and development, that is 56 days onwards. Okay, in which the development and some functional abnormalities can occur. So which drugs are responsible for causing the teratogenic effect, that is ACE inhibitors, thalidomide, warfarin and barbiturates. So these are the some examples of drugs. If the drugs are administered by particular pregnant woman, so they will causes the teratogenic effect. Then next terminology is the mutagenicity and carcinogenicity. So causes genetic defect and cancer respectively. Okay. So reactive intermediate which affect the genes and causes structural change in chromosomes. So what is mutagenicity? Mutagenicity means some reactive intermediate will affect the genes and they causes the structural damage to the chromosomes, that is called the mutagenicity. Even without interacting directly with DNA, certain chemicals can promote the malignant changes in genetically damaged cell, and that result in the carcinogenicity. Okay, so carcinogens means cancer causing agents. Okay, so that cancer causing agents directly affect to the DNA. Okay, and they may promote the malignant that change in the genetically damaged cells, and that's why that cancer causing agent can causes the carcinogenicity. For example, anti-cancer drug, radioisotopes, estrogens and tobacco. Okay, so these are the some examples of drug that causes the carcinogenic effect. The next is the drug induced disease. So this drug induced disease also called the iatrogenic, that is physician induced disease, and are functional disturbances that caused by the drugs. So what is the drug induced disease? Drug induced disease also called the iatrogenic disease, that is physician induced disease. Okay, and they may also caused by the particular drugs. So hepatitis is the major side effect of the isoniazid and rifampicin. Isoniazid and rifampicin categorized as the anti-TB drugs. Okay, so they will cause the hepatitis. Then peptic ulcer by salicylate and corticosteroid. So peptic ulcer again it is the side effect of salicylates and corticosteroid, and retinal damage by the chloroquine. So these are the some examples of drug induced disease. So here I have had some MCQs on the ADR. Okay, later on I will provide that all. So this is about the ADR. Then in ADR, as I told, whenever the monitoring of the particular ADR will be going in the PV unit, they will try to establish the causal relationship between the drug and adverse drug reaction. So what is that causality assessment? Causality assessment is the assessment of relationship between drug treatment and occurrence of the adverse event. So what is the causality assessment or causality relationship? It is the relationship between drug treatment and occurrence of the adverse event, that is called the causality assessment. So it is used to evaluate and check the particular treatment in cause of the observed adverse event or not. Okay, so why it is useful? It is useful for the particular treatment whether that treatment causes any adverse event or not, and that's why we have to determine the causative assessment. So it is essential part of ADR report and important task that conducted by National Pharmacovigilance Program in each country. Okay, so what are the objectives of causative assessment? So it will provide the relationship between drug and adverse event. and adverse event. Then signal detection. Signal detection means a possible causal relationship between adverse event and drug relationship being unknown or incompletely documented previously. That is called the signal detection. Okay, so it will provide better evaluation for the benefits and harmful profile of the drugs, and it also plays important role in evaluating the ADR report and early warning system for the regulatory purpose. So these are the some objective for the causality assessment. So here some three methods for the causality assessments are given. First is the expert judgment, second is the algorithm, and third one is the probabilistic method. Okay, so these are the some method come under the causality assessment. So first is the expert judgment. That expert judgment method, it is given by the Sweden. Okay, so it is used by WHO Uppsala Monitoring Center. Then second method is the algorithm. Algorithm is given by country French. That's why it is called the Denmark French method. And in the algorithm, the commonly used scale is called the Naranjo scale. And third method is the probabilistic method, which is given by Australia. Okay, and it is Bayesian adverse reaction diagnostic instrument used probably in probabilistic method. So by using these three methods, we can establish the causal relationship between drug and adverse event. So here we have completed what is the adverse drug reaction, classification of adverse drug reaction, then some terminologies in adverse drug reactions. After that, we have completed detection and monitoring of the adverse drug reaction. What is the causal relationship? What are the types of causal relationship? And how we can prevent the adverse drug reaction. So here we have completed the topic adverse drug reactions. If you are having any doubts, you can ask me.
Uh,
Amol sir?
Thank you, Vrishali madam. Yeah, yeah. Thank you very much.
Yes,
Uh,
sir.
we will see if any questions will be there. Actually, very nicely you have explained all the basic terms, elementary terms, which is
Thank you.
belonging to vigilance and basically pharmacology, especially with the terms like drug abuse, drug dependence. It is very minute. You can say gap is there, but you have explained it very well.
Thank
So
you,
it would
sir.
be helpful for our students also. Definitely, I think there will be no questions. Once again, thank you very much, ma'am, for delivering such a
Okay,
nice
okay.
lecture.
Thank you, sir. Thank you.
Okay.
Thank you, sir.
Now, I would request
Okay.
Mrs. Tejal, ma'am. Am I audible, ma'am?
Yes, sir, you are audible.
Yeah. If you can please share your PPT.
Yes, sir, sure. Okay. Is it visible, sir?
Yeah, 1 minute.
Okay.
Yeah, it is visible.
Okay.
Yeah.
So shall I start?
Yeah, yeah, yeah. You can start, ma'am.
Okay. So the next topic in the lecture is methodology in the pharmacovigilance. So before starting this topic is completely divided in two words. First is your methodologies and second is the pharmacovigilance. So as the Rushali ma'am said, what is your pharmacovigilance? It is the activities which are generally performed for the detection, assessment, then your prevention of the adverse event occur after the use of the drug or the use of the medicine. So, what is the basic focus of the pharmacovigilance is you need to improve the patient care, public health, as well as evaluate the benefit and sorry risk associated with the medicine. Along with this, the one important focus is to encourage the safe and the effective use of the medicine. So, in the pharmacovigilance, we are not only detecting the adverse event, but also we are evaluating the adverse event which is beneficial for the public health. Now, the next terminology, it is the methodology. So, what is the methodology or what is the pharmacovigilance methods? Okay. Before starting, what do you mean by methodology? As everyone know, during the drug discovery or drug development, the first phase it is your clinical trial phase. Okay, where the product is evaluated or the drug is given to few hundreds or thousands of the patient from all the population. Okay, and pharmaceutical company tries to note down or take the highest efforts to note down all the adverse effects seen during the clinical trial. But as the drug entered into the fourth phase, that is a post marketing phase, where the drug is taken up by all the population. Hence, the new adverse event are reported, and this new adverse event are now detected in the pharmacovigilance. So, for this reporting of the new adverse event, the various pharmacological methods are present. So, pharmacological methodologies are the various methodologies used for reporting of adverse event in your post marketing studies. Hence, the pharmacovigilance it is the having a greater importance. Now, as per ICH guideline E2E, ICH E2E guidelines, they in the ICH E2E guidelines, the various methods are listed down. For examples, passive surveillance, active surveillance, stimulated reporting, then comparative observational study, targeted clinical investigations, and descriptive studies. So these are some of the methods used in the pharmacovigilance for reporting of the adverse drug reaction from the post marketing studies. Now, all these methods are classified based on the source of the report. Just like whether the report is received from a healthcare professional or from consumer, or you have received the report through the internet, which is called as online reporting, then or the patient or the report is received from the certain organization. So depending upon the source of the report, the various pharmacological methods are given in the ICH E2E guidelines. Now, this E2E guidelines for pharmacovigilance methods gives you the best idea how to select the methods for reporting the adverse event. So these guidelines will give you the best method which is need to be selected for the reporting the adverse event. Next rule or next guideline given by the E2E, it is always maintain the confidentiality of the report. Okay, so patient confidentiality, reporter confidentiality need to be maintained, as well as maintain the highest possible standards of the profession. Okay, so these are the some of the guidelines given by the ICH E2E pharmacovigilance method. Now, whatever report, okay, by any one of this method, whatever report we received or whatever information we received from any one of this method is present in the narrative format, okay, where the complete narration about the adverse event, about the patient, about the reporter, and about the drug is provided. So it is called as complete case report. Okay. Now the complete case report basically contained four component which is mandatory. Then and then only you can use this report. The four parameters of any case report, these are the patient adverse event, drug, and the reporter or the source from which this report is received. Now, if you consider the patient, all the patient characteristic, for example, age of the patient, sex, race of the patient medical history, patient concomitant condition, patient concomitant medication, any information related to the patient needs to be mentioned in the report. Next parameter is the adverse event. So detailed description of the adverse event, starting from on which date the adverse event has started, on which place it is started, what is the severity of the adverse event, which diagnostic test has been performed for the detection of the adverse event. Any laboratory data related to the adverse event need to be mentioned. Third parameter, it is a drug. Okay, so, along with the suspected drug, the concomitant medication or the concomitant product which the patient is taking along with the drug needs to be maintained. Now, not only the name of the drug, okay, along with the indication of the drug, batch number of the product, then the lot number of the product, then the schedule of the drug, start date and the stop date of the drug, all the information need to be mentioned. Along with this, if the patient is taking any over counter medication, any dietary supplements, okay, they need to be mentioned. So whatever drug the patient has taken during that period need to be mentioned. And the last component, it is a source. Okay, the detailed information of the reporter need to be mentioned. So whatever case report received from all these pharmacovigilance method like passive, active surveillance or stimulated reporting should contain these four valid elements: patient information, adverse event information, drug information, and source information. Then and then only these reports are considered to be valid. If any one of this information is missing, you cannot use this case report. So before starting the PV methods, this needs to be understood. Now, today we will going to see two important method. First is a passive surveillance, which is widely used for reporting the adverse event, and second one it's a active surveillance. Now, as we have seen the four criteria for reporting the adverse event, okay, certain more information need to be mentioned in the report while reporting through the passive surveillance. Which are this information? Okay, the documents related to the adverse event or any diagnostic test. If the patient has performed any diagnostic test, any laboratory test, the document of that test needs to be attached with the case report. Next, the clinical course of the event, how the event is progressed, and the patient outcome, whether the patient is recovered or not. It needs to be mentioned along with the case report in case of passive surveillance. Now, if the outcome of the patient is not reported in the case report, for example, you don't know if the patient is recovered or not, the follow up needs to be taken with the reporter to get the final outcome of the patient. Now, from this outcome, you came to know the seriousness of the event. For example, if the outcome of the patient is hospitalized or patient is suffering from any life-threatening event such as coma, then you come to know the event is very serious. Okay. So, in the passive surveillance, along with the four basic elements, this supplementary information need to be mentioned in the case report. So, the passive surveillance. Okay, now we will start with our main topic, that is the first methodologies of the pharmacovigilance, that is the passive surveillance. Now, what is passive surveillance? This is the report, or this is a methodology in which the healthcare professional, that is physician, pharmacist, nurses, okay, these healthcare professionals or patient can send this spontaneous report which describe the adverse drug reaction occur after taking one or more medicinal product, okay, to the marketing authorization holder or regulatory authority. So basically here the report is generally reported by either healthcare professional or the patient after taking the medicine, either to the market authorization holder, or it is your pharmaceutical company, or to the regulatory authority. So what happen in case of passive surveillance? Sometimes it is a first report that are published about the adverse event. After taking the XYZ medicine, the first time this report has been reported by the patient or the HCP. So this is a signal generation. Okay. So this will stimulate the subsequent reporting. So this can be a initial phase of the signal generation. For example, here I want to give the same example, that is a case report of the efavirenz drug. Okay. So here the adverse event is the gynecomastia. Okay. So in 2013, the efavirenz induced gynecomastia is reported in the HIV patient. Okay. So this is the first report which is reported in the 2013. After that, all the reports related to this efavirenz induced gynecomastia has been given. So I will repeat about your passive surveillance. It is a spontaneous reporting by healthcare professional or by the patient about the adverse event which is occurred after taking the medicine, and it is directly reported to the market authorization holder, which is the pharmaceutical company, or to the regulatory authority. So if you see the passive surveillance, it is basically contained two methods. The first one and the important one, it is the spontaneous reporting, and the second one, it is the case series. So first we will start with the spontaneous reporting. So spontaneous reporting is the system where the functional adverse reaction occur after all the medicine has been monitored. So it is a major system through which adverse events are monitored. Now, as we have seen, it is a part of the passive surveillance. So reporter is either a healthcare professional or the consumer who is reporting to the company or regulatory authority or any other organization, for example the WHO, which describes that reports describe either one or more adverse drug reaction occur in the patient after taking one or more medicinal product. Here the spontaneous reporting is a type of unsolicited reporting. So as it is a individually reported, so it is called as unsolicited reporting. The report which is present in this spontaneous reporting, okay, they are either present in the two form. Either it is a hard copy, that is a paper based format. For example, the yellow card present in the United Kingdom, or it is present in the soft copy format, for example the electronic format, where the report is reported through the online mode. So it's an online reporting where there are applications for reporting of the cases. Okay. So in the spontaneous reporting, you can report either through your paper based system or through your electronic system. Now, in the spontaneous system, the medical secrecy and privacy needs to be maintained while reporting the any cases. The spontaneous reporting, they will gives you the information regarding the risk group, then your risk factor, then they can give the clinical features or the new aspects of the known serious adverse reaction or the unknown or the new adverse reaction. So this is the importance of the spontaneous reporting. Now, the spontaneous reporting, it is the individual report or it is a single report about the single patient. Okay. So, spontaneous reporting, it is also, it is your individual case study reporting. So, it is called as ICSR, individual case study report, where the single report is present regarding the individual or the single patient. So ICSR, that is the individual case safety reports, are generally used for detection of the signal, whereas this ICSR suggests the causal association or the causal relationship between the medicinal product and previously unknown reaction. So that's why it is called as signal generation. Now, there are certain advantages and disadvantages of the spontaneous reporting. So first we will go through the advantages. As the spontaneous reporting, it's the unsolicited reporting which is happening in the post marketing phase. So it will cover whole population, as well as it will cover all the medicine, whatever medicine the patient is taking in the particular duration. So covering of the whole population and all the medicine gives you more detailed information. Now, this spontaneous reporting, it is the continuous method which is happening or going throughout the life cycle of the medicine. Okay. As the in the post marketing cases, all the population are exposed to the medicine, certain new rare and serious adverse reaction can also be reported which is not detected during the clinical trial. So the spontaneous reporting cases are used for generation of the new signal. This spontaneous reporting, it is a most commonly used method in the pharmacovigilance as it is a inexpensive method. So advantages of the spontaneous reporting, you can major focus is the whole population is covered and this process is a continuous ongoing process throughout the life cycle of the medicine. As all the population is exposed with the medicine, the new and certain rare adverse reaction which is also detected which cannot be seen in the clinical trial. Along with these advantages of the spontaneous reporting, there are certain disadvantages. There is a chances of underreporting or the biasness. Now, as this reporting is done by the patient, okay, there is a chances that the complete reporting of the adverse event is not given. So it is called as the underreporting. Sometimes the biasness is also possible. Now, the second disadvantage is that there is a chances that only a major adverse event is reported. The major symptom is reported and certain minor symptoms is
I think there is a connectivity issue from Telman's side. Hello, Tejal man, am I audible? Hello. I think Tejal ma'am lost with her connection, internet connection. So what we can do, we can uh, end up with today's session. I think we can rejoin Tejal ma'am within few minutes. Within few moments, we will rejoin Tejal ma'am. Within few moments, Madam is rejoining. Yeah, Madam. Will you please share your PPT, Tejal ma'am?
Just give me a second, I'll share my PPT, sir. Sir, now it is visible. Amol, sir.
Yeah, 1 minute, ma'am.
Okay.
Yeah, it is visible.
Okay. Thank you, sir.
Okay.
Okay. So we have seen the four important elements for the spontaneous reporting. The next part of the passive surveillance is a case series. As in spontaneous reporting, only one report of the individual patient is seen. So, in the case series, it is a series of the reported cases. So, basically, it is a aggregate type of the reporting where we are receiving n number of the individual case safety reports. So, it's a series of the reported cases that will help to generate the hypothesis or the causal relationship between the drug and the outcome or the adverse event. So the example of the case series, it is published in 2016. It is about the case series of the gynecomastia, which is reported to the National HIV and Tuberculosis Healthcare Worker Hotline in the South Africa. So all the reports related to the gynecomastia is reported. So it is called as the series of the reported cases. So it is a passive surveillance, and the overall passive surveillance, it is an unsolicited reporting either in the form of individual case safety report or in the form of the case series. Now the second one, it's a active surveillance. Active surveillance, it is a solicited reporting. Okay, solicited means it is a pre-planned process. So it's involve the enhanced or the targeted monitoring of the certain events or drug. So here we are targeting a specific event or drug regarding which the signal is generated in the passive surveillance. So targeting of event or drug is done in the active surveillance and number of the adverse event has been checked. So it's a pre-planned process. According to the WHO program, this active surveillance is also called as toxic monitoring or the safety monitoring of the drug. Now, we will see what are the different types of reporting in the active surveillance. So, first one, it is called as sentinel sites. Okay. Now, in the sentinel sites, the adverse event data collected from the specific patient subgroup. For example, pediatric patient, diabetic patient, geriatric patient, pregnant patient. So this is a subgroup. So the adverse event are collected from the specific subgroup of the patient only. But there is a limitation to this kind of reporting. First of all, you are only studying the small number or the small group of the patient to target certain event or the drug. So there is a chances of biasness also. and it will increases the cost because you are not studying the whole population, you are studying the certain subgroup. So it's a increased cost, biasness, and lack of number of patient. It is a limitation for the sentinel slides. Now, in the sentinel sites, you are also studying the trend of the diseases, just like a corona. Okay, you are studying what all changes occur, what all mutation occur, which new symptoms you can see. It is called as trend of the disease. Okay, so the trend of the disease can also be studied through the sentinel site. The second type of the active surveillance, it is a drug event monitoring. Now, in case of drug event monitoring, the certain questionnaire is set regarding a specific adverse event or regarding the drug, depending upon your target. Now, this set of the questionnaire is sent either to the physician or directly to the patient. Now, how you can identify that patient or the physician? So, this information regarding the physician or the patient you will get through the electronic prescription data or through the health insurance claim, through which you will get the list of the patient and list of the physician. To this targeted physician and patient, this questionnaire form needs to be sent. Now, the patient itself or physician on behalf of the patient will fill this form. So, it is a kind of survey form. And through this survey form, you will get the information about the adverse event or about the disease. Now, certain form or certain cases, again, the information is not complete. For example, you don't know the final outcome of the patient. You don't know the final outcome of the disease. So, in such condition, the follow-up questionnaire form needs to be sent to the either the physician or to the patient. So, questionnaire form are of two types: initial questionnaire form, and based on the initial information, there is a follow-up questionnaire form. Till you get all the information about the adverse event, patient, reporter, severity of the event. Okay, you need to send the follow-up form, and the complete case needs to be the complete case needs to be there. So again, the disadvantages of this method is you require the frequent follow-up of each and every case. And the third method of the active surveillance is registries. So this registries is basically a list of the patient having a similar characteristics. So the registries are of two types. It is like a dictionary: disease registry and drug registry. What is disease registry? Disease registry contains all the patient having a similar characteristics in the same disease. So it's a disease registry where the characteristic is same about the disease. The second one, it is a drug registry where all the patients are exposed to the same drug. So you will get the information about the disease registry and the drug registry. Now, this information about the disease and drug is again collected in the form of questionnaire. Questionnaire needs to be sent to the healthcare professional or to the patient, and from this information received through this survey form, this disease registry and drug registry needs to be updated on the timely basis. So there are three types, or you can say three methods of the active surveillance: sentinel form, drug reporting, and last one, it's a registry. So if you see regarding the active surveillance, okay, so it is a standardized process. Okay, you are asking the information through the questionnaire form, so you are covering all the aspect of the cases. So it's a solicited, or you can say it is a standardized form of receiving the information, where there is a chances of getting the complete information. But in case of passive surveillance, the reports are directly reported by the physician or the patient. So that's why in the passive surveillance, the chances of underreporting is more, while in case of active surveillance, you can expect the complete information about the individual case. So active surveillance having an advantage, this is one of the advantage, that all the information you will receive which will help in detecting the signal. But again, the disadvantage of active surveillance, you are targeting a very small population. So regarding the cost, it will require more cost. Okay, and for the passive surveillance, it is a cost effective process. So today we have covered the two major pharmacovigilance method, the passive surveillance and the active surveillance. The remaining method we can see in the next session. uh, Amol sir.
Yeah, madam.
uh,
Have you
Sir,
done with
I'm
the?
done. Yes, I'm done with the two method, done with the session.
Okay, madam. Uh, Thank you very much for delivering the recent advancement of this topic. So thank you very much. I hope student understood it very well. Comprehensively, you
Thank you,
have
sir.
given the lecture. So this, I think we should end our session. Sorry for the interruption, which we have created due to internet connectivity. So with this, we are ending the session now. Thank you very much.
Thank you.